are we there yet? ACL reconstruction is a successful, and it has been successful to restore knee stability, but the surgical outcomes can be compromised by poor biological healing responses. In fact, these healing responses include inflammation, repopulation of healing cells into the tendon graft, bone tendon junction healing inside tunnels, and the reorganization of collagen matrix at the graft mid-substance. In fact, the graft does not, what's been argued is the graft itself does not heal. And what it is, it's more of a remodeling process influenced by regional responses to grafting. We're going to learn about this and much, much more from someone who I believe is easily a world authority, and more importantly, a respected colleague and friend around the world. We are very, very lucky today at OE Events to be able to share with you insights from Professor Patrick Jung, who is the professor and chairman of the Department of Orthopedics and Traumatology, head of the sports medicine team at the Chinese University of Hong Kong. It is with great pleasure that I invite you and welcome you today, Patrick.
Hi, Mo. Good morning. Thanks. Good morning for you, and good evening and good afternoon for other people attending this. What I say is more like in-house discussions within the friends groups and interested partners, right? So my honor to be here to share with you some of our little works on this area regarding the biological enhancement of ACL reconstructions. Are we there yet? Simply because we still have a lot of problems, questions around this area.
Right.
But my honor to have the invitations of my colleagues and my good friends, Dr. Blumer Fu is the research associate working in the same department with me. And essentially, he is helping me in taking care of all this basic science and translational research in ACL reconstructions.
Right.
So he did a lot of works in Hong Kong in these areas. Indeed, started by Blumer, right? So my great pleasure to have him with us tonight and today, right? Okay. So if you allowed, I would like to start my presentation. Is that okay?
Please.
So I would like to share my screen. Good. So can you see my slides, right?
We can, yep.
Yeah, let me go back to, yeah. Okay, cool. So I'm going to start, right? So today I'm going to talk about the biological enhancement of ACL reconstruction. So I'm presenting on behalf of my team, including the guest today, Dr. Blumer Fu, and one of my PhD students, Ms. Yao Shi Yi. She's working on the same topic with me, right? Well, this is our university. I think Mo has been with us several times, the Chinese University of Hong Kong. So, and we have a teaching hospital, which is the Prince of Wales Hospital. The one on the top right-hand corner is our newly built private hospital, the first one and the only one in Hong Kong, solely owned by the University Faculty of Medicine of the CHK, so which will be incorporating clinical research and educational surveys by the end of this year, right? Well, today I'm going to talk about ACL, right? Essentially, I'm a sports trauma surgeon. So one of my major work is dealing with this anterior cruciate ligaments, right? Well, just give you a little bit of figures how common it is in Hong Kong and around the world. In Hong Kong, roughly, we are talking about 5,000 cases of ACL reconstructions being operated in Hong Kong per year. And indeed, this is one of the most commonest elective orthopedic operations in hospital. And all around the world, I think including Americans and China's and Europe and so on, we are roughly estimated there is about 1 million cases of ACL surgeries being done all over the world per year. So it's quite a huge number. Well, if you look back into literature, the result of conventional ACL reconstruction successful rate is roughly about 70 to 97%. It seems to be quite well, but bear in mind that this is a so commonly performed procedure. If you look at the other way, that means that the failure rate is roughly about 10–20%, right? So such a very commonly performed procedures with failure rate, like for example, rupture, or about 10 to 20%, we are not that satisfied with this, right? There are lots of reasons, leading to this relatively unsatisfactory successful rate, because people are still talking about what is the best surgical method for that, how to enhance the healing of the graft even you've put in well and fix it well, and how about later on rehabilitations, still debatable, and then how to assess the outcome of treatment and the guideline for return to play after the ACL reconstructions. And not to talk about nowadays, people talk a lot about the injury prevention program. Now, those are the current hot issues in orthopedic sports medicine around the ACL. And essentially, all these problems are the research gaps that our academic surgeons want to look at that, right? Well, this is a group just last summer in Pittsburgh. Professor Freddie Foods, invited about 40 surgeons around the world to come over to Pittsburgh and then attend this ACL Consensus Symposium. And we discussed about the different issues, sitting together in-house closed meeting for all the hot topics, difficulties in ACL reconstructions, from reconstructions, healing, and later on rehabilitations. What we think important is that, right, we need to fix well the surgery, and then the graft inside needs to heal well, and finally, we have to rehabilitation well so as to have a good outcome. Now, today, we are not talking about the surgical side, nor the rehabilitation side, but a very important issue is about the healing of the graft, right? Let me bring you through the different stages of graft healing after you put in the ACL tendon, for example, a hamstring tendon inside the knee joint, right? Well, there are some problems that can happen. For example, the synovial fluid may get entrapped inside a bone tunnel and affect the healing. So that's why surgeons think about remnant preservation surgery. And the tendon bone healing will be compromised because of tendon, graft motions or tunnel widening. So people think about better fixation method. But even more important, we think that when you put in the graft needs to heal inside the tunnel and also change to become a ligaments inside the joint. And they go through different stages. So that's why all these stages can be compromised because of the hostile environment inside the knee joint. And we need substance to improve this hostile environment and improve the healing response. So now, gentlemen, right, what are the evidence so far and what have we done in Hong Kong? So in the coming 20 minutes, I'm going to bring you through some of the evidence so far we have, right? This is a systematic review that our group published in OJSM several years back, reviewing some clinical studies and animal studies regarding biological modulations of ACL reconstructions, right? Another paper is published about 2 years back about the different kinds of biological enhancements in ACL repair. Well, essentially, the conclusion is that the efficacies of clinical application of biological enhancement nowadays is still very inconclusive, right? From the 2 papers that we reviewed. If you look back into the different papers as shown here, which not talking about animal studies, but specifically on clinical trials and all this, some say yes, some say no in terms of biological enhancement for ACL reconstructions. Well, there are lots of problems that we have to think about if you are going to put in something to enhance the ACL healing. We call it biological factors. First of all, what are the source of these factors? Well, you can't just get exogenous factors every day. Can we mobilize some endogenous one inside your body? And how to deliver these biological factors into the potential area that you want to enhance, inside the joint, into the tunnel, and so on. And how to retain and localize all these good factors around the area that you want it to action, right? So those are the problems that we need to think about. So how can we enhance the healing, right? Now, I just want to briefly, very quickly bring you through the different stages of ACL graft healing. After you put in the graft, you fix it well, and then initially there's an angry inflammatory phase. And then later on, the blood vessels comes in, the graft remodels, and then we will go through the ligamentization and become ligaments inside the new joint after 1 to 1.5 years. So the initial stages, the graft needs to survive with the hostile environment. And then later on, we need to give a good environment for it to remodel into the ligament. Now, those are the key stages of how the graft behaves inside the knee, right? So in this, from some of our previous work, we found out that, right, inside the tunnel, the poor tunnel bone qualities can compromise the graft healing. And also, there are other factors that can lead to poor graft incorporation. For example, synovial fluid going into the tunnel and so on. And inside the knee joint, the intra-articular graft, the intra-articular part, the graft may be degenerate, and that may compromise the ligamentization process. Those are the hostile negative environments that may affect the graft healing. So if we really want to enhance the healing, we would think about two different strategies. Number one is that we understand that there's a very inflammatory angry phases that we need to go through. So we want to decrease these stages, these inflammatory stages, or reducing the effect of these angry stages. On the other hand, later on, when the blood vessels comes in, the graft remodel and become a ligaments and also further bone tendon healing, we want to increase the positive factors of this graft remodeling. So there are two different ways that we can approach it. Also attacking the ligaments inside the knee joint as well as inside the tunnel, right? So indeed, this is not just what we think about. There are other researchers agreeing with the approach, right? By accelerating the bone tendon healing as well as the intra-articular ligamentization, probably we can allow the patient to go back to sports earlier and safer. So with this, we start with some animal studies first, because we really want to make sure that it's safe and doable, and then translate into human being. And before that, we need to establish our animal models, right? And then later on, we start the product development to try the target of this, biological process enhancement. Right? So this is our way of developing our animal models in ACL surgery. And indeed, nowadays, a lot of different centers have been using these same models, right? We use rats, and so we harvest the flexor tendons over the leg, and then drill the tunnels, and then fix it, and then we look at the result, right? So this is the animal model that we have built on our own. Now, after you fix the ACL in the animal models, you need to assess the outcomes, whether it is good or not. So how to measure the healing process? In human being, we use different ways, either the MRI to look at the graft maturity, revascularizations, integrity, and the tendon-bone interface healing. And a lot of people also use CT scans to measure the tunnel widening as well as the bone tendons infiltration and so on. Our Japanese group of friends, Professor Michio Oichi, look at the synovial coverage to try to document and measure the healing process clinically under arthroscopy. Koshishino and other Japanese surgeons, indeed, almost 20 years back, already developed a probe, a laser probe, to try to measure those surface blood flow of the reconstructed ACL. So those are different ways that you want to see whether the graft heals quite well or not, right? Well, you can see in the patients, we have these different outcome measures, MRI, CTs, clinically rupture or not, knee laxity, functional outcome. If we want to know whether our strategy is good or not, we need to be able to assess our animal models. So that's why over the years, we developed different our own strategies to measure the outcomes of the animal models. Either looking at the histologies and also the load to failure test to test for the laxities, and also functional analysis using a gait analysis, right? So this is how we test the mechanical test for the stability and the strength of the reconstructed ACL, and also the pull-out graft test. And also we want to assess the function of the animals. We can't ask the animals for IKDC or the others, LICOM score and so on. So we try to assess how painful they are after the surgery, and we have this limbs idleness index being developed, right? Now it has been quite commonly used by others researchers. Also, we look at the tendon healings inside the tunnels by looking at the micro CT, as well as the histological, sacrificing the tunnel tendons and look at the histology. So those are the outcome measures that we develop on our animal models with the propagations as shown here by our team. Now, after developing the model, we look at strategies to try to enhance the healing now in the animals, right? So as I mentioned, we want to decrease the graft degradations while we want to enhance the graft remodeling. So how to do that? We think about if we can those cosmetic surgeons and so on to give a magic solutions to rejuvenate, your skin and so on. So that we want to make it simple, easy applications. Can we try to inject some things, into the knee joints during or after the operations, so that these magic solutions can enhance the graft healing? So we think of different strategies using biomaterials, biologics, and cells, right? So today I'm going to bring you through this, right? Biomaterials, right? We have advocated to use, develop our own biodegradable magnesium interference screws, which is soft, absorbables, and can enhance the bone tendon healings inside the tunnels. Moreover, we also prepare and develop some magnesium sutures to try to braid the tendon, which a lot of surgeons use it to do that, to prepare the tendon graft. And then and we understand that this magnesium suture can enhance the bone tendon healing. It shows in different studies. So we do this on the animals, right? And fix it and put it into the knee joint. And then later on, with collaboration with our friends from Utrecht, we develop a so-called smart sleeve. What does that mean? Well, we want to develop something to cover the tendon graft, which can attract some endogenous growth factors to the respective area that we want the growth factors to be there. As we understand, those growth factors inside the tunnel needed for enhancement of bone tendon healing is different from growth factors for enhancement of the ligamentization process inside the joint. So we develop this growth factor specific binding peptide protein to develop a bioactive films that can bind specific endogenous growth factors from the surrounding environment. And we create this into a bioactive films, wrap it around the tendon. So for example, the films around the bone tendon tunnel is absorbing the BMP endogenously, while the films wrapping around the intra-articular bark is attracting the TGF. So we have finished animal studies and published and shows a positive effect. Now we are moving towards the directions to manufacture into a clinical applicable films that can be used in the clinical environment. How about manipulating the cells to enhance the healing of the ACL? I think people are talking about stem cell therapies, and this we want to go back about 6 years back, talking about the applications, animal studies and human study. At that time, they think that it is not ready yet, right? Another papers looking at like porcine models also at that time didn't show any positive significant effect on using MSCs to enhance the ACL graft healing. Our friend, Professor Rasuki Kuruta and Masa Kurosaka has developed the use of ACL remnant cells, but this has been done only for the rats, right? And found that it has a positive effect for those young patients only, right? And a few years back, our team has developed our own tendon-derived stem cells, and then we prepared this tendon-derived stem cells into a cell sheet that can wrap around the tendon. And in animal studies, we found out that this wrapping around the tendon can enhance the bone tendon healing, right? But I have to admit that it is not easy to translate into clinical applications because the film is so fragile, and then you can easily damage that in a real human being applications. So we are still struggling with the clinical translation. And we published our research in HASM a few years back, right? Finally, I want to talk about biologics, right? Freddie has talked about the inclusions of using fibrin cord to enhance the graft healings inside the tunnel. And then, well, at that time, they shows that, there's some improvement in the signal intensity of the graft inside the MRI in human being clinical studies, but probably, they still can't really prove that this is a significant enhancement of the healing or not. So, but that is indicated indirectly that may enhance the graft healing and maturation using a fibrin clots, right? Similarly, fibrin clots, we think about nowadays PRP, right? So different people are talking about using PRP to enhance different biological enhancement of healing of different soft tissues. And we've proven that it has been useful to help to enhance the bone tendon healings in animal studies. But the problem is that we can't repeatedly inject the PRP, over the 6 months, 9 months of rehabilitations. So we think about how to slowly release this PRP. So we develop the inclusions of the PRP into the hydrogel so as to allow some slow release of that, right? Well, indeed, this is a systematic review about the usage of PRP in ACL reconstructions, just published very, very recently. And this is a current level 1 evidence, since didn't support the use of PRP to improve the graft healing. Indeed, Mohit and myself have collaborated to publish PRP applications in orthopedics, right? It seems that while it has been shown to be in some cases or some applications good in reducing the pain, but the clinical significant efficiency is still very limited, right? Well, we have also targeted to try to use other ways, biologics, to enhance the bone tendon healing. For example, we all know about this bisphosphonate in treatment of osteoporosis. We use allogenate to try to enhance the bone qualities of the tunnel, and has been proven to be able to enhance the bone tendon healing. And similarly, in articular part, we also want to improve the graft maturations and so on. GHK Cooper has been well known to be used in some cosmetic or plastic surgeons or some cosmetics, right, to decrease the oxidations and also improve the rejuvenations of those collagens. So we have been shown to prove that the application of GHK Coopers can promote the graft remodeling and incorporations and ligamentizations. But again, we face the difficulty of that we can't sustain or continuously inject this GHK Cooper. So that's why, again, we applied into hydrogel to have a slow release, a temperature-sensitive hydrogel application so that it can slowly release this GHK Coopers inside the knee joint. Recently, we also think about how to decrease the very angry initial inflammatory stages of degradation of the graft. So we put in vitamin C irrigations, right? And we have been proven in animal studies that this is able to decrease the graft degradations and enhance the graft healing. And now we are in the, this is the animal trial, animal studies, and now we are entering the stage of clinical studies to include this vitamin C into our irrigation, saline irrigations while we are doing the ACL reconstructions. Now, ladies and gentlemen, those are what the works we have done, including all this like intraoperative and postoperative applications of these magic solutions in different ways to try to biologically enhance the ACL graft healing. And we also publish a systematic review of all this. And if you're interested, you'll always go back to this. Apart from all these biological interventions, we also think about how to enhance the graft healing even after the surgery. So there are different ways that we have tried, including some clinical trials or physical enhancement of the graft healing, like using shockwave, ultrasound, functional electrical simulations, such as shown here on animal studies, and also shockwave and so on in clinical studies. So ladies and gentlemen, just want to go back to our very original questions. Is this biological enhancements of ACL reconstructions, are we ready yet? Are we there yet? I think, as you can see from my presentations over the past 20 minutes, we still have a lot of difficulties, especially on this biological enhancement, how to deliver these biological factors to the place that you want that to be there, contain it, localize it, and it can also add on at the appropriate time and appropriate place. So it's talk about the spatial and the temporal, factors that we need to think about. I've shown this slide before. The source is an issue. If you can mobilize those endogenous biological factors, that will be good. How to deliver it? You can't. ACL is a very keyhole minimal invasive surgery. You can't open it up open up the knee joint in order to put in these biological factors, right? And how to retain it and localize it is also an applications problem that all the surgeons need to think about it. And that's one of the obstacles that we have been facing over the past 10, 20 years in this area. So ladies and gentlemen, I just want to conclude that there are lots of challenges in managing ACLs. As I mentioned, enhancements of the graft healings biologically is one of the challenge, but this is the direction that we really want to do more through basic science, clinical, and translational researches from the bench to the field to solve these problems. So with that, I would like to thank my research teams and particularly Bloomer over the years in all this, support for all these different kinds of research. So thank you very much.